Welcome to the video on significant change in dissolution test on stability. Simply you can say it as dissolution failure on stability. Many of the times the pharmaceutical professionals face this problem of dissolution failure for the stability samples of the pharmaceutical formulations. Dissolution failure for the stability samples may happen during the research phase, during the exhibit stage, or before application, or it may happen during the marketing or commercial production stage. Dissolution is a product performance test, and dissolution test serve as a in vitro test for providing you the information regarding the in vivo behavior of the formulation. That's why the dissolution test is related to the safety and efficacy of the formulation, and failure of the dissolution is categorized under significant change in the stability study. And if dissolution failure occurs, if it is a significant change, then the product fails in the stability study. So significant change in the dissolution is change in the rate or extent to which the API or drug dissolves during the stability studies. Significant change in dissolution simply means failure to meet the predefined dissolution specifications. If your dissolution is not meeting to the predetermined specifications, then you can say that there is a dissolution failure and it will be a significant change. Stability studies are done to assess the shelf life, to assess the impact of various environmental conditions. Stability study is done to assess how the drug product's quality, safety, and efficacy evolve over time under the various exposure conditions or environmental conditions, which involves variation in the temperature, humidity levels, and light. Significant change, as we have seen that there is a failure of the dissolution to meet the predetermined specification or finished product specifications. So when you can say that there is a dissolution failure, if your formulation is immediate release type of formulation and if you observe slow release, for example, if you set the Q point of ATQ and if it is not reached in the defined specific time, let's say for 15 minutes or 30 minutes, that time you can say that the dissolution is failing. Or if your formulation is sustained release, extended release, or prolonged release, and if dose dumping occurs during the stability studies, then you can say that there is a failure in the dissolution. Sometimes the modified release formulations, when tested for dissolution, cannot maintain the release ranges. The release may be too slow or release may be too fast when the formulation is placed onto the stability. So that means there is a dissolution failure. If your formulation is delayed release type of formulation, that time more than 10% release in acid phase or acid stage or slow release in the buffer phase denotes that the formulation is failing, not meeting the Q point or not meeting the release ranges means the significant change. So you might have learned about the S1, S2, L3 criteria or L1, L2, L3 criteria. When you can say that my dissolution is failing. If you perform the dissolution testing on S1 stage, you cannot say that it is failing. You can go to S2 stage. If it is failing there, then you can go to S3 stage. But if the dissolution is failing still after the S3 stage or L3 stage, then there is a significant change and there is a dissolution failure. So if you perform the dissolution on 24 units at third stage and if it is failing, then you can say that dissolution is failing and there is a significant change in the dissolution. Now we will see why the dissolution failure occurs during the stability. See, there might be changes like physical changes, chemical changes, or microbiological changes, packaging related issues. Many problems are there. Many of the reasons are product specific. So, physical changes like change in the crystalline form of the API, change in the crystalline form from more soluble to less soluble may result into dissolution failure. Moisture uptake by the formulation, change in the tablet hardness or disintegration time may lead to dissolution failure. Change in the particle size of API in the formulation, which may be due to the aggregation or crystal growth. This may happen in the liquid formulations. Gelatin cross-linking may happen, which will give you the slow release. The coating onto the tablets or pellets may get cracked, or there may be a curing effect or aging effect, which will change the dissolution profile. See, these changes I have enlisted here is based on my knowledge, my understanding, and my experience. Some product specific reasons may also be there. So it depends on to the formulation type and the stability studies, whatever is performed, which is product specific. Dissolution may also fail during the in-use stability study. So that will also be a significant change. Then chemical changes like API degradation, there may be an interaction with the API, some hygroscopic API or loss of the disintegrant property may also be there. Sometimes some APIs get complexed with the excipient and that complex is less soluble or insoluble. So that time dissolution get failed. Formulation instability may also lead to failure of the dissolution. Formulation instability involves excipient changes like granule hardening or powder hardening. Some particles get hard. Then over lubrication may be there during the manufacturing, which leads to formation of the insoluble layer around the granules or particles, which on stability leads to dissolution failure. Then is the storage conditions. There may be degradation or physical changes due to improper storage, temperature and humidity exposure. Sometimes if the packaging system fails, that time the dissolution changes may happen. Seal integrity, if it is failing, then it can allow the moisture or oxygen ingress, which leads to changes in dissolution. Then what is the impact of the dissolution failure? So if your dissolution is failing in the R&D stage, then you can reformulate the product, you can change the packaging, you can change the composition, manufacturing process, many ways are there. But if the dissolution fails for the product which is already onto the market, that time product recall may happen. So to prevent the compromised bioavailability and patient safety, the product recall is done. Then regulatory impact of dissolution failure is like regulatory scrutiny will be there, which will require additional stability testing or which will require reformulation or even suspension of the marketing approval. Then bioequivalence concerns are there because of failure in the dissolution. Dissolution failure will lead to failure in demonstrating the bioequivalence, particularly for the generic formulations. Many impacts will be there based on to the formulation. So how to prevent the dissolution failure? The formulation point of view will be reformulation by adjusting the excipients like disintegrants, super disintegrants, their type and levels, changing the API particle size or optimizing the formulation, changing the manufacturing conditions or manufacturing processes. You can use improved packaging to have moisture resistant pack or to prevent the moisture ingress. You can use stabilizers, antioxidants, buffers to have dissolution similarity for the stability period. Alternative manufacturing processes can be used. If you have a product containing insoluble API, you can improve the solubility by making the solid dispersion by HME or spray drying. You can optimize the formulation and particle size of the API for soluble type of formulations. So depending on to the formulation type, the type of remedies will be there. Then how to investigate the dissolution failure? If you have tablet formulation, let's say for example it is a IR tablet, and if it is failing in the dissolution specification, then how to deal with that situation? How to investigate? So dissolution testing can be done for the samples stored in different packs, different storage conditions, and these are compared with the control samples. Study the water content or water activity of the formulation, study the LOD, and compare it with the initial control samples. Perform DSC or XRD to understand whether there is any change in the crystalline form or whether there is change of amorphous form to crystalline form. Then impurity analysis will give you understanding about the degradation. Then perform physical tests like hardness testing, DT time, disintegration testing. Then perform stress studies and accelerated stability studies so that proactively you can know whether there is an impact of storage condition onto the dissolution. Perform open exposure studies for prediction. You can store your sample at a higher temperature, higher humidity condition for shorter duration of time so that you can have prediction for the dissolution. Perform packaging studies, evaluate the packaging, store the samples in different packs, and then understand whether the samples are failing into the stability or not. Then other product specific investigations can be done. So this is the information regarding significant change in the dissolution test on stability. In the present video we have seen what is dissolution failure, when you can say that dissolution failure occurred, what is significant change in dissolution, what are the consequences, why dissolution failure occurs, how we can investigate, and how we can prevent or avoid the dissolution failure. So whenever you are performing stability studies, always have good understanding and have clarity of the basics for data evaluation. Also, whenever you are performing stability studies, load the stability samples in different packs, in higher packs and lower packs, like the most protective packs and the least protective packs, so that you can bracket the medium packs, and then you can have prediction for the dissolution failure or dissolution testing on the stability samples. So this is the information regarding significant change in dissolution test or failure of the dissolution on stability. Thank you for watching the video, and let's meet you soon with such kind of informative video. Thank you.